are on. Okay, welcome everybody. 10 a.m. on the dot. We're going to get started in a second. We're, however, going to test our tech. So if folks don't mind saying hello in the chat, that'll tell us if we're good to go on being able to use the chat, because we're going to rely on that through the presentation as well. If you're not sure if you're in the right room, we always want to ensure that that's the case. So you are at the Help Seeker webinar on safety, community safety and well-being. 18 months of lessons learned is what we call it. And yeah, hopefully it's going to be a really good one for y'all, and things that you might not know already. That's always the goal. So with that being said, I will share my screen and just get going on some of the housekeeping bits and bobs. And like I said, let's see the chat here. Yeah, looks like we're on. Hello, everybody. Awesome. We always love to also do some shout outs too. So I'm taking a look and seeing who I know. And we also love to hear where you guys are joining us from. So if you know, well, of course, you know the organization and the city or community you're joining us from, but if you also know your Indigenous or treaty number that you're joining us from, or even the Indigenous name of your city, like that's your kind of next challenge, that'd be really great. And we'll do a couple of shout outs as we wait for people to log in here. Yeah, it looks like snowy northern Ontario, Edmonton, Geraldine from Waterloo Regional Police. Hello, Geraldine. I wonder if I met you at the Safety of Our Cities conference this year, was in your backyard in Peel region. So not quite. Sean from Calgary, Treaty 6, Lisa, Cassandra from Yes, Youth Empowerment. I love Yes. I've been in your facility many times before. Amazing. Yeah, keep saying hello to each other, guys, because this is as much as learning about this great country, and everything that you guys do in your communities as well is really cool. So if folks have the ability to connect with each other, then you've got friends all over the country. So as much about you as it is about us. So we've got a jam-packed session, and I'm gonna start without kind of further ado. Is that the right term? I'm not quite sure, but we'll get her going, like I said, because we have so much to chat with you guys about. So hopefully folks can see my screen, and yeah, we're in full screen mode. So Alina Turner here. I'm gonna be your MC for the day. I'll start with the land acknowledgement for myself as well. Help Seekers team is all over this place that we call Canada, further known as Turtle Island, well before that. And I'm joining you from Moncton, Calgary, and Treaty 7 territory. Lovely picture from my friend Michael Thatt, Dene Artist. If anybody's looking for Christmas presents, drop me a line. He's always looking for buyers as well. And this is just a little sample of his art. We're gonna also have somebody join us from the city of Victoria, just because you're probably sick of hearing from me all the time. So Laura, who looks exactly like like the picture, unlike me, who doesn't look like her picture anymore. But
She's
that's
here now. Hi, Laura.
Hi, Laura. Nice to see you. And looks like your tech is working as well. So welcome. And I'll let you introduce yourself more fully when your time comes to share about the City of Victoria's approach around this very, very big and hairy topic of community safety and well-being. But yeah, we had the pleasure of collaborating with Victoria this year on their community safety and well-being, and their mayor is such a firecracker too. So loved getting to know her as well on the project. All right, so a couple of again, setting the stage components. It's not going to be a help seeker talk if we don't get into data as well. But I will say that some of the work we've done this year has really highlighted for us that the community safety and well-being agenda has been really shaped by the post-pandemic shifts. So we always want to make sure we're couching what's happening in bigger structural pieces that are at play, And sometimes in our local communities, we forget, we go so micro that we forget that this is a much bigger trend that is not just happening in our own backyard. There's something else afoot, and we're always trying to figure out what's driving some of these trends underneath, because they're not just trends that we're seeing in Alberta or British Columbia or Ontario. We're seeing them across the country. We're seeing them in rural communities, and we're seeing them in northern remote communities, and we're definitely seeing them in our mid-sized and urban centers, but they play out very differently as well. So what I will say is everybody has structural challenges in common. How they manifest locally is very different, however. So for instance, lots of chatter around complexity of coordination of care tends to happen in bigger urban centers, makes sense. Lots of how do I deal with lack of resources is a very, very common theme in smaller communities. So the types of solutions that we're going to talk about today need to account for that difference as well. So I'm not going to tell rural communities they need to coordinate better. They already know, everybody that's in the community. There's only one program, so that would be a silly thing to do. But for sure, in major centers, the complexity of the system is that much greater. So your challenges are around, we don't have a list of people, and we don't have a list of services. And so those basics that rural communities have in their back pocket are not present there. The other big shift that we're seeing, and it's obviously to do with Canada taking reconciliation hopefully much more seriously, is also the emergence of Indigenous leadership in this space. And so I'm going to talk a little bit about one community that I've been supporting around their public safety approach. So Indigenous communities taking ownership and control over their safety initiatives and really assuming that sovereignty, building their own kind of bylaw capabilities and community safety strategies that are culturally responsive and built by community for community. Very, very, very cool stuff happening there that we should be learning from. And of course, the other overarching trend is around youth. And so lots of innovation has been happening between policing, education systems, social services, and funders as well around targeting vulnerable youth. So I'll speak about one specific project, Project Blackfeather also in BC, but a really cool way of bringing data in this space as well. And tech innovation. Tech is driving some of the structural changes, people losing jobs due to automation, lots of movement of humans because we've just got better mobility as well. And after the pandemic, everything's been opened up in terms of immigration and migration and travel. But tech innovation is also disrupting a lot of the workforce as well. And we're starting to unfortunately see that automation taking away some of the labor's power, for instance, and you're seeing it play out in the union conflicts right now that you might not know it, but there is a tech disruption underneath that as well. So pros and cons, making things go faster, but also disrupting some of the wage security and wage parity and equity as well. So those are the big kind of, and that's all I'm going to say about structural things, but I think it's an important one to keep in the back of your minds as we go into this further. So now we're diving deeper into what's been happening across the country when it comes to building safer communities. And the Building Safer Communities Fund, which is quite a keystone project initiated by the federal government under Public Safety Canada, has been one of the great kind of innovation catalysts, I would say, in the past 18 months for sure. And I'm going to speak to projects that we're involved in because that's my bias. That's what I know. But lots of effort happening around gun and gang violence because of this funding. So this federal funding is being taken up by communities across the country, and some of it was pre-assigned. But interestingly, and I'll speak about it later, there is an open call for proposals right now that might open up this to those of you that are looking for funding to do innovative projects in your community on this file. So we've been working in Victoria, like I mentioned before, Burnaby, Langley, Thunder Bay, and Moncton. A couple other ones, but these are the ones I'm going to, really leverage in my talk. And so they're all looking quite a bit different. The commonality, like I said, is the structural pieces I referenced before. They're all trying to address those challenges in ways that are localized, but I really see that common thread around structural challenges underneath, and the challenge being, of course, that we're talking about things that are getting worse, not better as well. So gun and gang violence becoming kind of flare up social challenges more and more. Whether is it happening more, or is it that we're recognizing more? There's always that problem in terms of the data. Is it being reported more, or is it actually happening? I would definitely say that, having looked at the data, I can attest that there's definitely a perception that safety is a growing challenge. There's a perception of safety, but then there's also the reality that there are these violent incidents happening in communities that are hitting the media and are actually happening as well. So definitely nothing to scoff at. So of course, the challenge becomes, how do we actually measure whether this is happening in the community or whether this is a perception as well? And with that, it's always about using data to drive decisions, but it's also being honest where the data is limited as well. And so the obvious takeaway is the tools that we have need to kind of to match where the community is at. So surveys, dashboards, statistical models. I'm not going to tell you, if you've got a team of one, that you need to use very advanced statistical models to really track this. But I can tell you to leverage some of the survey tools out there to get a kind of snapshot of where your community is at this point in time, and understand, the perception of safety, and then leveraging some of the data that's already available and being collected to analyze those patterns over time. I'll also tell you a little bit about how to track some of these challenges from open data as well. So definitely the quantitative analysis in terms of proving that this is a growing issue and kind of digging into why it might be happening is really critical to building an effective response. And I'll tell you a second as to how that is. But I will also tell you that you need to go beyond numbers. And this is why the Victoria use case is very interesting, because their quantitative data didn't tell the full story, and it hardly ever does. It's important, and you need it in your back pocket, and it needs to be part of your analysis. But you're never going to get there if you're not digging into the qualitative, the real stories from the community. So in one community, for instance, there was pop-ups where essentially staff go out, so service staff or outreach workers or even policymakers do a pop-up event. Very, very simple. You literally throw up a little tent, kind of card, and grab some Timbits and just get talking to people. And what we did in one community is actually had our phones out, and we would kind of record our insights on the spot into our technology kind of backend, and then we would process that qualitative data to get numbers. And I'll show you what we were able to get out of one community that, unfortunately, I can't tell you who it is for their own privacy, but I am okay to share you the results of that. So these open-ended surveys, because technology has come such a long way, you don't need to make this perfect survey. You can have some guiding questions, and all we had is like 2 questions. Do you have any concerns about safety in your community? And tell us about it. That's it. And then we were able to just take that qualitative response in those 2-minute conversations, 5-minute conversations on the street. We talked to 2,000 people like that, and we were able to get this amazing, rich insight. So just because you don't got the quantitative doesn't mean you shouldn't try to get the qualitative. And the qualitative is really where the really, really, really cool stuff comes through. So I'm showing you what we were able to get out of one community safety and well-being survey. But of course, it's nothing if you don't interpret this stuff as well. So this is another way that you can get at some of this information is your typical qualitative to quantitative survey. And the whole idea here was to understand the breadth of experiences and how these things are being kind of coinciding, right? So the same person was asked these various questions, and then we analyzed. And these are different dimensions of well-being and safety. So those of you that are interested in measuring safety, and I know some of you are because that was part of the questionnaire when you came through, How do you measure some of these things? So everything from healthy food to your connection to people around you, reaching out to local parks and places for fun, affordability of your home, all these things are your welcomeness in your community, etc. These are all connected, as you can see, and there's a relationship here. When you look at the data from just a bar graph kind of perspective, there's things that you don't necessarily see. So I'll show you the other part of it. Is that you can actually do what's called a correlation heat map. So those same responses, what you're looking at here is their connection to each other. And the cool part here is that we can actually understand the relationship. And so in this community, for instance, the data showed us some really interesting things. So safety and feeling socially welcome show a perfect correlation, showing that personal security and social inclusion are inseparable, right? So
Alina,
yeah.
can we pause? We just had a comment that it's really hard to see your screen right now. Is there a way that you can try to make that a little bit bigger?
Yeah, absolutely. How's that, guys?
Thank you.
Yeah, thanks, guys. Thanks for letting me know. Absolutely. Thank you. Hopefully this is okay. Check the chat if I need to zoom in any further.
I can see it much better, so I'm hoping.
Oh, wonderful. Wonderful.
Yeah, perfect.
Yeah, awesome. Thanks, guys. Yeah, please do let me know.
Thank you.
Yeah, thank you. Yeah, so this is that same data, but I'm just showing you what you can do with this data, right? Because now it's interesting. Now it's telling us something. So it's telling us that safety and feeling socially welcomed have this perfect relationship in this data set, right? It's just one little survey that well, not little, but it was lots of people in this community. So it suggests that safety is fundamental to social belonging, right? Of course, and we can see the relationship here, how closely aligned they are. But also safety and learning are inseparable, and safety and mental health are connected. Now let's look at safety's role in health. So safety and physical health, just like look how connected these are. Safety and job security, safety and economic security, less so. Job security, yes, but safety and cost coverage, safety and cultural connection, definitely a positive relationship, less obvious. Let's look at safety and basic needs, another one, right? So safety correlates very strongly to access to basic needs, suggesting secure environments support that fundamental well-being, and community spaces, and that's another one. So your ability to participate in recreation, participate in parks, participate in get access to proper housing, all of these are entwined. So if anybody's kind of considering doing a safety and well-being strategy, these are kind of some of these really critical ways of measuring. And you can flip it the other way around to say, to analyze the data from the basic needs perspective and its relationship to health or relationship to learning access. But here the lens was really safety. Big takeaway is safety and belonging, safety and some of this well-being aspects really track in an aligned fashion. So where they don't, where we have these gaps, then we can understand some of the ways to deal with it. And also, if we don't deal with some of the housing, the economic security, learning access, that's also going to impact safety, vice versa. So that's just one aspect of what you can do with this data. And this takes no time at all. I mean, I shouldn't say that. It takes technology, but if you have the technology, it takes no time at all to generate some of these really cool visualizations and interactive ways of presenting the data. Because of course, the next step is like, what do I care? Why do I care about this? So that's one consideration. Building that concept around equity equaling safety. Now, one of the things that we have seen, again, trending nationally is some of the, and again, this is part of your data storytelling. So connecting the local to the national. We see that from 2015 to 2021, 194% increase in the number of victims of violent hate crimes motivated by race or ethnicity. So back to my point earlier around your sense of safety and your culture, your sense of social belonging, those that are of a different background, of newcomers in particular, their data shows that there's a very, very different experience for them as well. And so this jives between the one community and it jives with the national data set as well. So when people are saying, hey, I'm experiencing this more, or I'm experiencing this differently, it makes sense that we're seeing that trend also at the national level. So another consideration. Now, what I was showing you before is perception, right? So perception of safety and then reported. These are reports. So report and perception are obviously entwined. If you don't perceive something happen to you, then you're probably less likely to report it. So one of the learnings that we had doing this work in Thunder Bay and Burnaby and Victoria, et cetera, is that perception matters as much as reality sometimes. And so crime's effect on safety perception, we actually see a huge, huge connection there too. So for instance, in, again, the same community that we can't tell you who it is, but it's in BC and it's big. Individuals who experienced physical attacks reported lower average safety scores than those who had not. So again, your likelihood of perceiving that you're safe is impacted whether you had experienced something before. If anybody saw what happened in Vancouver yesterday, those folks that saw that or that experienced that, their sense of safety has now really deteriorated because of that experience, as if the trend holds in Vancouver as it does in this community. It makes sense. Again, targeted victimization. Victims of crimes based on race, religion, identity felt significantly less safe with an average safety score of 5.64. So again, your experience in your identity location will also impact your safety score as well. It suggests that targeted approaches for folks of varying races, religious beliefs, and identity, so LGBTQ, for instance, need those targeted interventions as well. And the cumulative impact. So safety perception dropped as victimization experiences increased. 3 or more types of crime, the more safety incidents you experience, the more likely these perceptions are going to deteriorate as well. So how people feel should factor into your community safety and well-being strategy, not just the hard number, so to speak, but also how it's perceived. That's just as critical. And again, it's about breaking that safety perception and protecting us from them. It's about creating that sense of weight. After 9/11, I was going to say, but interesting slip of the tongue there. After 9/11, but also after COVID, we saw this kind of binaryism happening in society, and that also has been playing out in these these perceptions of them being the problem and those people creating the nuisances in the neighborhood, etc. And it's a hard one to flip, right? It's especially when media and the stats keep confirming these biases too. Is it a bias, or is it that certain populations are experiencing vulnerabilities and experiencing some of the factors that contribute to involvement with the justice system? So there's a constant fight you have to and balancing act that you have to play between these challenges. More and more, though, we're seeing that that chatter around, well, this isn't us, this is them, and confinement. We need to go towards more treatment requirement based approaches, etc. So that vibe is going to really permeate in the coming year. So what can you do now to start to set up for mitigating some of the risks in that binary thinking with your approaches? So what kind of strategies can we put in place now? The other piece that I wanted to bring to reality here is the violence and exploitation around the most vulnerable as well, and how this again intersects with our perceptions of violence. So here's again some data from the Uniform Crime Reporting Survey. So this is Statistics Canada via policing reporting. But again, hopefully you guys can see this, the upward trend from 2012 around human trafficking by statute. Lots of valuable public education has been happening on this, but that doesn't discount the fact that this is this is trending upwards as well. So be on the lookout in your community safety and well-being for human trafficking related strategies as well. And don't discount that just because you feel you're in a rural community and it's not a thing. That's actually not turning out to be true. We see some of the higher incidents happening, for instance, in rural Alberta versus in some of the urban centers, because women or vulnerable populations are being kind of collected and streamed into port cities or hub cities as well. So how it looks in your community, the grooming, the online chatter, that's where you can keep an eye out for this as well. And of course, the social media traffic that is targeting young people specifically in those vulnerable communities. So the criminal kind of mindset has been to really go after communities that are underserved and underprotected, and showcase the same vulnerabilities that I'm presenting to you here. So poverty, kind of vulnerable neighborhood pockets. In smaller centers, it's going to be literal apartment buildings where you have high density and low income coinciding, newcomer populations. Those are really being targeted. Everything from a home takeover to building block takeovers to street takeovers to entire community takeovers are the trend. And so the human trafficking and drug trafficking being the two main revenue generating businesses for organized crime, you're seeing it everywhere. So don't discount that in your well-being strategy as well. All right, how am I doing for time? Okay, couple more bits. The intersection around substance use and safety demands, compassionate responses. I obviously have a very, very big focus in our work on substance use and the changes in substances on the street. We're always keeping an eye on what's coming in next. What we're hearing again in the chatter from the US and the Latin American countries is that there has been, again, the crackdown around trade and Trump, saying that, it's so funny to say that term in a sentence in a webinar, but Trump has been clamping down around this concept of limiting trade. If those bad hombres and their drugs come into my country, then I'm kind of threatening you with these tariffs. So he's done that with Mexico as well as Canada. And so that concept has been translated into Mexico starting to try to crack down on some of the trafficking, but that's not a new thing. It's not like they didn't know this was an issue before, but we are hearing that there is a wave of less toxic fentanyl coming through. Now, is that materializing in less overdoses and less? I haven't seen it yet, but we have heard that there's less toxicity in some parts of the US because of this recalibration. Whether that's going to manifest, like I said, who knows? There's also the reality that lots of the substance use, the substances themselves are not coming straight out of Mexico, that they're actually coming straight from China, India, etc. as well. So having said that, what do we do about it? Safety and well-being strategy has to tackle the substance use challenge as well. So addiction prevention program, addiction education program, and preventative efforts around youth and youth understanding what's actually in the drug supply, collaborating with schools, etc., is really critical. At the same time, treatment facilities and harm reduction efforts need to account for the reality that we are moving into a recovery system-oriented public policy regime, at least at the federal level, and definitely in Alberta, BC, Ontario, we're seeing that coming through. So how we balance how many recovery spaces versus treatment versus harm reduction, that continuum of supports needs to be spelled out. Otherwise, it's going to happen to you from a political stance versus from a systems planning, data-driven stance. So those would be my suggestions. There is a reality, though, that housing first programming doesn't come from a substance use first approach. It comes from a mental health and coinciding with substance use. So we do see places like Alpha House, for instance, that have been in the game for a long time, starting to innovate new approaches to manage the new substances. So modernizing housing first approaches so that they are much more substance use of the day ready. So the types of program models, the types of case management that is needed now, the types of skill sets that are needed now in those Housing First teams have to modernize, have to catch up with the reality of the day, including the caseload ratios as well. If you're interested in that further, I can connect you with folks that are innovating in this space as well and tell you more about it. So when safety breaks down, I mentioned before, what are you going to see in your communities? That criminal exploitation, everything from a home takeover. And if you don't know what a home takeover is, and we have a whole paper on that, we're happy to share it. It's not a new concept, but it happens quite a bit, like I said, in social housing. It happens in low-income neighborhoods, low-income housing, but also in vulnerable seniors, for instance, vulnerable women and their children. So that the impact is severe, right? Because it's almost like a virus. It spreads. Once you have one house taken over, it can actually spread into the neighborhood as well. So be on the lookout for that and know the signs of home takeovers happening in your community as well. Like I said, if you haven't heard of this before and what it looks like, we have a paper, a signals paper on that, and my team can send it out with a package after this. And the good news is that there are ways to prevent it as well, with targeted prevention and education efforts, looking out for it in your caseload as well. If you have clients, the kinds of questions that will get at whether this is happening in their lives, whether somebody's actually, it's like a squatting phenomenon, but it's much more exploitative than that as well. And of course, the youth at the crossroads. So wanted to bring it back again, that we do have post-pandemic a trend in youth and their type of substance use being quite different as well. So as you can see, it's happening, and it's happening across the age groups. Good news is, the trend is kind of seems to be okay, but we don't have data from the most recent cycle. So unfortunately, it will seem to be going down during the pandemic. What we're actually hearing is that this data is way behind, and that's not holding true to what's happening on the ground. So that's why those qualitative surveys are really essential. And that's why targeted prevention programs are really, really essential. So Project Blackfeather is one project that we've been involved in setting up and evaluating. And this is, again, BSCF funded by Government of Canada, and a partnership with the Langley School Board. Big shout out to them. And the Langleys, City of Langley, Township of Langley. And what they're doing there is actually a database way of identifying the highest risk kids for gang involvement, and targeting them with wraparound supports that tackles every single thing that I talked about before: housing stability, transportation, recreation. You got stuff to do, social connection, food security. And so the budget is no longer limited to, oh, you can only do this, you can only do that, you need to see this counselor. They actually have kind of counseling chits that they can spend where they want. If they want to do art therapy, graffiti therapy, doesn't matter. That's the concept. And so the early ideas are that if we intervene early with their highest risk and we can identify them through school data, then we can actually turn that around. And it's being delivered by the school system for these kids as well. Of course, with tons of community partnership and support and funded federally. So that's a really great way to mobilize your school system. Despite operating under significant restraints, there are these funds out there that we'll talk about as well. So safety doesn't begin and end with enforcement is the message. Build it into the everyday actions of empowered communities, and those community-led approaches become really essential. That you can't just expect the police to address gang violence in and of themselves. They're not a resource for it. They're not the entire safety net. I've talked about this many times. They're one of the smaller pieces of this really big safety net that we need to mobilize around common safety and well-being aspects. So knowledge is power. Public awareness in safety is essential. Obviously, the more you know, the better you do. And with that, I'm going to pass it to my colleague Laura, and who can introduce herself and what Victoria is doing. And you feel free to tell me to be your secretary today and move things around for you.
Awesome. Thank you so much, Elena. And thank you for that really great introduction and setting the scene. There was a lot of pieces that I wrote down myself that I thought, oh, this is so relevant, so key, so significant. Pieces about schools being the key. When people feel welcome, they feel safe and secure. All those are central themes that we're seeing. And I'm sure everyone else is seeing in their communities as well. So I'll get you to move the slide over. Perfect. It's great to see so many people on this call. For those of you that I haven't met, I have met a few of you before throughout this work. My name is Laura, and I'm a staff member in the city of Victoria, explicitly within the mayor's office. Our city is doing something a little bit differently from a lot of cities. I see a lot of you come from community safety departments within your city, and the city of Victoria doesn't have that, or maybe yet. It could be something we're looking at down the road. And so this is kind of a space that is new for us to step into, that we've been working on for the past year. And I think we've done some really exciting things, really interesting things. And I'm hoping that some of what I'm sharing today is useful for those of you in big cities, but also possibly for those in small cities as well. I'll go to the next slide. So I'm joining you today from the traditional and unceded territories of the Lekwungen speaking people. Those are nations known as the Songhees and Cossapsum First Nations. And I always want to kind of take a bit more of a moment on the land acknowledgement than sometimes what we typically do, because it's the relationship with First Nations is key to any community safety and well-being work. We're really fortunate at the City of Victoria that we have a longstanding and really authentic and genuine relationship with both the Songhees and Cossapsum Nation. They are our leaders. We look to them to learn, to understand, to share, and they're really great partners. And as you all know, the work of community safety and well-being has to incorporate Indigenous knowledge, Indigenous truths, Indigenous history, because this is their land. And so every step of this process, we've been really careful and conscious that we are guests on this story, on this territory. And more than that, we are on stolen territory that is not ours. So we have an obligation to do better for those nations, for their nation members, for their leadership, and for the displaced urban Indigenous people that call Victoria and this beautiful land home. So I'll go to the next slide. So there's 95 people on this call today. Some of you may have been to Victoria, some of you may haven't, but I wanted to start by kind of setting the scene in Victoria. We are a very small city, but a city nonetheless. We are about 19.5 square kilometers, which is very, very tiny. We are on the southern tip of Vancouver Island, so a little bit more southern than the rest of British Columbia, which means we get lovely warm weather and a lot of rain, but we're a really desirable place to live in as far as that goes. For safety and well-being, we're in a really unique position compared to a lot of cities, partly because of our very small size, but due to a whole other host of factors. And Elena, I'll get you to move to the next slide, please. We are a really dense city. Majority of our population are renters. The provincial average in British Columbia is that 64% of people in communities own their own home. In Victoria, it's the opposite. 64% of our residents are renters, which is a really high population of renters, and it kind of changes the dynamics in the city a little bit. We're also a very dense city. I have the number up there, and when we compare that to the city of Toronto, for example, we're actually more dense than them. So it's a lot of people kind of packed into a really small area. Being 19.5 square kilometers, it also means our tax base is really limited. So in comparison to some of our bigger cities, we're kind of in a bit of a difficult position that way. We've got a mild climate. We're also a capital city. There's a lot of eyes on this. I think starting this process, something I learned was that a lot of people around BC have a lot of thoughts about what happens in Victoria, and people across the province and even across the country feel a lot of attachment to the city itself. So not only are we contending with our own 94,000 residents, or just a bit over now, we're actually closer to 100,000 residents, we've got a lot of eyes on the province, which is a really great honor, but poses some interesting challenges as well. We've got a really engaged population in the city. The old adage that I'm sure many of you have heard is that Victoria is a city of newlyweds and nearly deads. And while I don't think that's completely accurate, there are some truths there. We're a government city. A lot of our residents are people that are top policy officials, government officials, and people that are really, really engaged in government and processes, and in a lot of the conversations that we're having as well. We're small and confined, as I mentioned. We're also the urban center of a larger district. The Capital Region District composes 13 municipalities, everything from very, very tiny to very, very large, and kind of everywhere in between. Ourselves as in the city, we are surrounded by other local governments. And as I'm sure you can imagine, trying to get 13 mayors and 13 councils all on board to move in the same policy direction is quite a feat. So we're really thankful that we work closely with the Capital Region District, but sometimes that creates some interesting challenges as well. But most importantly out of that, we are the service delivery center for the entire Greater Victoria region. We have most of the hospitals, supportive housing, shelter beds, and resources within our city. We are the downtown core for the whole entire region. So while our population is about 100,000 people, we serve a region of about 450,000. And the usual numbers I lean to is the city of Victoria is about 10% of the landmass of the Greater Victoria area. We're about 25% of the population, and we have about 80% of the supportive housing and shelter beds as well. So there's a little bit of discrepancy in the numbers there, but being that we are a downtown core, it's something that we have to do. And Alina, I'll get you to move to the next slide. So Victoria, the three things I'm hoping to kind of share in this presentation, the three takeaways, are that engagement is a community building activity. Engagement is part of the community wellbeing process, and it has to be part of the community wellbeing process for your work to be successful. The second thing I kind of want to, or I hope you take away, is that community wellbeing is an act of reconciliation. Community wellbeing has to be done authentically, intentionally, and with a reconciliation lens always. And the third thing is that local guidance is really the key. We've learned so much from so many other people and organizations and groups. I've learned so much from some of you on this call today. I've read plans from across the country, but ultimately local guided solutions are really the key. So Victoria started this process about a year ago, a little bit more than a year ago, I suppose a year and a half, in about July of 2023 with a Public Safety Canada grant. We knew that what is perceived to be a decline in social order is creating huge conflict within our city, and was in July of 2023, and it still is today. We're seeing huge conflict between people that are unhoused and other city residents. This happens in our downtown core, it happens in parks, it happens in public spaces and malls and businesses, and it continues to cause escalating tensions. Our residents, our businesses, tourists, people that are unhoused, people with experience in the homelessness system have became extremely frustrated with gaps in the system, with systemic problems and things that they don't perceive as getting better. The pandemic, as for everyone else, I'm sure, was really kind of a tipping point for a lot of us. We were really great about coming together in the early days of the pandemic and solving immediate challenges. We created tiny home villages. We worked together with stakeholders to get everyone a safe place to be. And a lot of that's crumbled. And some of our good social will has changed, and people are viewing our problems with social disorder very, very differently than they were. Which creates more challenges. Again, I'm sure you have all felt this as well. From this, our council created their 2023 to 2026 strategic plan. They identified the creation of a community safety and well-being plan as a key priority, and it's something that as staff we've acted on quite quickly. We have the same problems that everyone else. We have a really high cost of living here. We're the fourth most expensive city in the country. Not really something we're proud of, something we're working really hard to change. But we know that there's huge gaps in the system that contribute to this. There's no one single bullet that causes homelessness or safety concerns or displacement of people. It's a whole big web of intertwined systems. We know that wicked problems are key. Inaccessible housing is key. Inaccessible transportation is key. A lack of health service, mental health services, racism, discrimination, all these things. So it's a big task to tackle, and it can be really scary for local governments. This is not our usual area that we work in. But I'm going to kind of borrow a line from the Mayor of Victoria, Mary Alto. She always says that for 20 years, local governments have been saying that housing is not our responsibility and healthcare delivery is not our responsibility. It's up to the province, and that's true. But I think we're at the point where instead of saying it's not our problem, we should be asking if it should be. And if somebody else isn't taking their care of these things, then who's going to do it? And our answer in the city of Victoria is that we're going to start doing it because we can't do this anymore and our residents can't do this anymore. So I'll go to the next slide, please. So with this, in July of 2023, we built what we called the Community Leaders Panel, which was a selection of members from the community from a variety of different sectors and branches within the community to kind of be the overseers of the initiative, is what we've called them. So that it consists of 11 folks, all from, like I said, from various sectors within the community. And their goal was to lead this work, to guide this work, and to provide some oversight. However, a big key on that is while we selected people to be part of this work, they were selected by the mayor. We didn't pick people because of their organizations, and we didn't want people to feel like they had to represent an organization. As an example, we have a former chief medical health officer from Island Health. And we were very clear at the beginning, he was not there to represent Island Health. He was there because of his knowledge and his passion and his background and the things that he could contribute. So it's a really diverse group. We've got members from the Songhees First Nation. We have police members, firefighters, health officers, community members, volunteers, people of all different ages and backgrounds. We've got somebody from the immigrant community and a variety of others. And it's really been a pleasure to work with them for starters. We've been meeting monthly since August of 2023 and sometimes a little bit more. And they're kind of the owners of all of this process. So while I'm the one here speaking to you today, the panel are really the people who take this work. And we'll go to the next slide. So when we started building our community engagement process, we wanted this to be something that was looked a little bit differently from other city processes. Our city, like I'm sure many of you, do a lot of engagement with a lot of different folks. We work on budget engagement, OCP engagement, regular check-ins, feedback, surveys, all these things. And we know a certain demographic always tends to lean or always tends to answer these kinds of surveys. And so we wanted to kind of break the mold a little bit and do something a bit different. We wanted to make sure our process was accessible for everyone, regardless of your age, your gender, your location. In a lot of ways, we know a lot of people from across the CRD have a lot of opinions about what goes on in Victoria. People go to school here, they work here, they commute here, they shop here, they go to restaurants here, and they care about what happens in our downtown as well, even if they live in Langford or Saanich or Sydney or Highlands or Metchosin or somewhere else. So we wanted all of these things, whether you had a lot of money or a house or no house, to come into effect, and we wanted to make sure that you had a chance to provide your feedback. We wanted to break down those usual barriers to participation, and we went in with the mindset that all feedback is good feedback. We wanted to be human, we wanted to build on existing relationships, and build something a little bit different and aggressive. I'm not going to spend too much time on this slide, but this was kind of our approach to engagement. Two pieces here that I'm not going to touch on are the targeted discussions and the existing data. Like many of you, the City of Victoria has a lot of pre-existing data, and there's a lot of organizations doing a lot of work in this space. That includes a lot of data that already exists about homelessness and what people need. And so we didn't want to repeat any of that, and we turned first to all of those sources. The targeted discussions as well were key stakeholders that the mayor and our panel met with to learn and hear from their stories. But what we really wanted to focus on was hearing from the rest of the population. I'll go to the next slide. So the first engagement approach we did was our general survey, and this was your typical survey that a lot of you would have seen before, but we tried to do it a little bit differently with our questions. It was online. We also had in-person copies available at City Hall, and it was general questions about perceptions of safety, challenges, solutions, demographics, and those sorts of things. I really liked what you said earlier, Alina, about how perceptions are so important. And we know that we can look at victimization stats and crime stats and say that X number of the population has experienced crime, or that there have been so many robberies, for example, or vandalism cases, but that doesn't really tell the full picture. And what's important here is if people feel like they are safe or feel like they're unsafe, then that's all that matters. So we asked those general questions. We wanted to engage large numbers of people. We worked with 1,000, or we ended up getting 1,660 respondents. And we asked questions like this one here. What brings you joy about living in Victoria? And what would give you a greater sense of belonging in Victoria? These are really kind of big questions, broad questions. But they're also speak to kind of a different part of community safety as well. Our survey had a lot of open-ended, broad paragraph questions. Any of you in the data field know how hard that is to analyze and to assess. But at the same time, it gives you really, really great and amazing data. We also had a lot of quantitative data like what you see here. This was one of my favorite questions about what makes it challenging to find a suitable place to live. I won't go through each of these pieces, but there's a number of pieces that were really significant and really important that we're taking on into other city processes like within our planning department. Things about transportation being a huge barrier to finding housing that works for people is really significant. And we'll go to the next slide. I see a question here. Do you pay a stipend to your leadership panel members? So we don't pay a stipend to the leadership panel members for the most part. The City of Victoria has a policy that any person from a vulnerable group gets a stipend. So our Indigenous participants all get a stipend for their participation in the panel work. But we do also do things. We always provide food and meals to make sure people are compensated. And anything over and above, we do pay a stipend. But I'm going to talk more about stipends later on as we go into some of the different pieces of engagement that we talked about. So our systems change survey was trying to get to some of those deeper problems. We all know when we do a survey, the same people respond and you're kind of going to hear the same things. We knew that. We knew what we see in our Facebook page comments were going to be replicated in the survey. And while we got some really amazing data in that survey, we knew we needed a way to get a little bit deeper. So we went with the systems change survey. And this was a survey that spoke specifically to organizations and people with a deeper knowledge of the systems of community well-being. We sent this to targeted groups and organizations, people like shelter workers, supportive housing workers, frontline service workers, healthcare members, and beyond, and asked them to share within their networks. We asked questions about what their organization needs to be successful, and what organizations need to be successable, what barriers people saw with their organizations, and what they think if they could do anything for community safety and well-being, what it would look like. So I've got that one example question there. We heard a lot of this kind of response. We've got an unsustainable funding system. There are inadequate services. And we don't have enough people with lived experience working within our systems and our institutions to really guide this work. And I'll move to the next slide. I see another question there. Did you develop the survey or work with consultants? We did work with consultants for most of it, or for some of it. We worked with the Canadian Centre for Safer Communities. They helped us build our first survey in particular, and then our panel guided the rest of the work and created the questions themselves. The next piece we did was our facilitated conversations. We actually hired 4 facilitators from the community with very specific knowledge and backgrounds within certain sectors and organizations. These 4 facilitators did an incredible amount of work reaching out to organizations that the leaders panel identified, meeting with them and kind of guiding these conversations. So we had a representative from the First Nations who worked specifically with First Nations communities. We had an immigrant engagement expert who worked both within the immigrant community as well as students and arts communities, and then a variety of others. Through this work, we identified over 40 community groups and networks that they met with, and we held very open and low barrier and accessible conversations. We didn't start these things with a set of questions. We didn't ask, what makes you feel safe? What have you observed? We started with general, broad, open questions and let the conversation flow from there, which was really phenomenal, but it was a little bit scary in a lot of ways. That's really hard for data assessment to not have set questions. But doing this partly recognized or helped recognize that these conversations are really personal for a lot of people, and they're really scary and really intimidating. And you're asking people about things that can be really traumatic and can cause a lot of PTSD or bring up PTSD. And we didn't want to help or to further cause harm in any of these conversations, recognizing that sometimes we do. So a key, as I mentioned, that the city has a policy where we pay people for their time, particularly vulnerable people, and that's exactly what we did. We gave our facilitators stacks of $20 bills and asked them to walk up and down major areas or areas with major homelessness encampments and said, hey, I'd like to ask you questions. Are you okay if I ask you questions? Are you okay if we chat? Are you okay if I record this? And sometimes the answer was no, I'm not okay if you record this, and that's okay. And so our facilitators listened, and even though they weren't recording data, it was still an exercise of community building in itself, and there's a huge value in that. The next slide, we're talking about our community pop-ups. This was the last thing we did, where we looked at getting our kind of last wrap up of information that we learned, and we wanted to make sure every last person had a chance to provide feedback. So we went into various different organizations or groups or neighborhoods and had these pop-up style events. We had just questions on a board, very open. The one you see here is what's one thing that the city can do to help make you feel more safe, provide sticky notes and snacks and juice boxes, and we went out and did it. We did these in farmers markets, which were wildly successful, popular downtown lunch spots, neighborhood groups, and more. I see another question there. How are funds dedicated for all the planning, hiring consultants, paying facilitators, etc., and from the municipal budget? So yes, this came from our municipal budget. Largely, we also got a Public Safety Canada grant that's been paying for a lot of this. Within our city operations process, we've gone through the procurement and hiring just like anyone else. But that's kind of been where we've funded all of this work. And the key with all of this has been decolonizing the process. We're talking about systems that are inherently colonial and are really resistant to change. Institutions are built to withstand the forces, and colonial institutions were built to be difficult to change. And so while we know we can't change all of it, we wanted to start. So one example of this is we don't have a terms of reference for our community leaders panel. That's a really hard thing for a local government to do. But we also know that terms of references are really binding and they're really colonial in their inherent processes. We don't use Robert's Rules of Order. Again, something kind of challenging on an administrative side. How do you take notes? How do you govern yourselves? But we started at the beginning with a really authentic way of using the governance of our local nations and focusing on conversations. I'm going to borrow a line from a local elder that I really, really love and I've learned a lot from, who always says that there are better ways of conducting meetings that aren't Robert's Rules of Order, but colonialism doesn't teach them to you. So we've kind of tried to embody that spirit in some of those traditional administrative roles that we do. We've done paying people fairly for their knowledge, recognizing the power of stories, of lived experience and oral histories. A lot of our engagement work has been directly with the Songhees and Cossapsum nations, as well as the urban Indigenous people that are displaced within our community, so people not affiliated with either of those nations. We've met with the Métis Nation of BC. We know that at least 35% of the unhoused folks in Victoria, as well as across Canada, identify as Indigenous, and that doesn't even speak to the vast majority of unseen homelessness that we see in our communities. So this has to be about Indigenous relationships. We value the nations as nations. Their governance, we work government to government with them. We pay them for their time, and we try, although we know we're still learning. We know we have a lot to go in terms of decolonization. But again, we're really, really proud of the work that happened there. We all know that systemic racism means that Indigenous people are much more vulnerable to these systems. So working directly and hearing with those people about what they need is key. On this slide about what we heard, I don't want to focus too much on this. I'm sure none of this is a surprise, but a couple of key things is we heard a lot of racism. That's really significant. We know that it exists. We know that it happens. but it was really key. And so something we're moving forward with is making sure that we're acknowledging that and working within our city processes to do better and to help our neighborhood groups and our organizations and stakeholders do better. We know we've got gaps in services. We know that there's not enough communication, but most importantly, people were so excited to be able to share with us. They were thrilled that we were having these conversations. They were thrilled that they were being asked. And we're seeing a lot of gaps, particularly in an era where news isn't on Facebook anymore, where people don't know what's going on, where cities, including ours, have closed down our Facebook comments because they can be spaces of vitriol and hate. But people feel really disconnected from their local governments. And so this process brought people together, connected people, and that in itself is an act of community building, and it's essential for community well-being. And I know we're getting near time, so I'm going to wrap up really quickly, but I'll go to the next slide about where to next. So we finished this work really kind of recently. We've wrapped up our final consultations in the summer. We're in the process of writing our report now, and it's going to come to council in January of 2025. So I don't want to give away anything too big yet, but there's going to be some really big, bold, and intentional solutions. Our goal is to really challenge what we're doing to kind of break barriers and to be a leader. And like I said, be intentional, because you have to be intentional in this work. I'm happy to answer questions. I know we're a little out of time, but I'm happy to share my email address if anyone else has any questions. And I'm reading the chat here, and there's some really great dialogue happening. And Christine, I totally agree. No city can claim to be the city of reconciliation, because we're all in a process of learning, and there's still so much work to do. But it's a real privilege to do that work. So thank you.
My goodness, there was so much that you did there, and thank you so much, Laura. That was brilliant. And of course, we're always out of time. I'm like notorious for it, because there's so much to talk about. So hopefully you guys got some insight around our last 18 months of learning with these amazing projects. And again, I really encourage you guys to think about some of the applications for doing some of this work. There is money available to do it. Folks that are interested, we're going to send the actual link. December 20th is around the corner, but actually that's plenty of time, right? Plenty of time to put something together, and lots of programs available to do this work in your community. Everything from initiatives around risk and protective factors, Indigenous and Northern communities, and youth gang prevention as well. So there is available investment for these. It's not a lot, but it gets you going. Like I said, we're going to send you guys some of these resources as well of what other communities are doing. You heard about Victoria, but there's lots of places across the country in this space. And last plug, thank you again, and hope to see you in our January Social Trends Outlook. This is like our annual look at what social issues are going to be trending in terms of priorities and where government's going, but also where we're seeing the grassroots emerge around solutions as well for 2025. So sign up for that one, and we will see you in January, if not before that. And thank you so much, Laura. That was fantastic. What a firecracker. Thank you so much for doing this work with us and for doing what you're doing in your community. Brilliant. Thank you. Thanks, everybody. See you next time. Bye now.